Good morning, students. Today we are going to discuss September 2016 Community Medicine Paper 1 question answer key discussion. Though the question is not in the screen, I will read the question. First question is the 10 mark essay. As a medical officer recently recruited in a primary health center, you will find that there is a cotton mill in your area and its workers utilize your health services. You want to investigate whether their health is affected by the work environment. What type of study design will you use? What are the steps of such a study? How can you analyze the data that you have collected? So the study design here we use is the cohort study. Okay, cohort study design we are using. The steps of the cohort study, you know that you have to write. Then the steps of the cohort study, I will the steps in a selection of the study subject, obtaining the data on exposure, then selection of the comparison group, then you have to follow up, then you have to analyze. This way you have to do the cohort study. So cohort study, then steps of the selection of the study groups, obtaining the data on the cotton text exposure, the selection of the comparison group, internal, external, others, then you have to follow up, then you have to do the analysis. The steps I have scrolled above, they are the same. Now, what are the steps of such a study? You have to write selection of the study subject you have to do, obtaining the data on the cotton text exposure you have to do, selection of the comparison group, internal, external or others you have to do, then you have to do the follow-up, then you have to analyze. So how can you analyze the data that you have collected? Analysis of data, for that you know what are the statistical methods that we apply in a cohort study. That is, the first you have to calculate the incidence rate, relative risk, attributable risk, the population attributable risk and its interpretation. Note that the other study design can also be considered as it is PhD setup and considered the shortage of the time of study. But ideally for a this factor is cohort study, but you know you are appointed a PhD for a shorter duration, so you will be transferred. So sometimes you can't complete a cohort study within a 6-month time period. So another study design also can be the answer, but better answer is cohort study. Then the second 5-marker question is a problem based question. There is a mosquito menace reported in the primary health center area where you are working. What steps you will take for the vector control? So mosquito menace management by medical officer, first you have to do the situation analysis. But in whatever the problem, what you have to analysis, that heading should be the situation analysis. Then different vectors and diseases caused. You know the Aedes mosquito, then Culex, they are all the other vectors who cause the mosquito based diseases. So the different vectors and diseases should we have mentioned. Then different methods of mosquito control, for that we can use integrated vector control methods. Then IVM, and it's important. Then Down syndrome child management. Suma, there is another third question that is also not in the screen, but I will read the third question. That is a 5-marker problem based question. Suma, aged 2 years with the Down syndrome, is the only child to her parents who bring her to you for advice. How will you proceed to manage considering the various levels of prevention? You know, Down syndrome child management levels of prevention are failed. That is the why a baby has born with Down syndrome. Primary, it is high maternal age, previous history of abortion. Secondary, it is anomaly in scan, karyotyping, cardiovascular system examination, that way. Then okay, primary high maternal age, previous history of abortions, Then secondary anomaly scan, karyotyping, CVS testing, disability limitation and rehabilitation, prevent the recurrence in future pregnancy. So primarily, why you have to high maternal age is the main reason you have to counsel here. So then secondary anomaly scan and karyotyping should be done, that you have to say to her for further pregnancy if she is planning. Tertiary, the disability limitation and rehabilitation, recurrence in future pregnancies. And fourth question, it is a short answer question, 4 marker question. First comes the record linkage. What do you mean by record linkage? Record linkage and its implication, events commonly recorded, the uses, disadvantages, methods of the record linkage. The neurolaterism, what is it? Its characteristics, toxin present, stages of the disease and prevention. Then embryonic, study of science of health travelers. Study of the science of health of the travelers, its contents, problems faced by the travelers, the recommendations. Now question, cultural factors that affect health. Cultural factors are deeply involved in all the affairs of man, including health and sickness. Concept of etiology and cure, that is supernatural causes, physical causes, environmental sanitation, food habits, mother and child health, personal hygiene, sex and marriage, regarding menstruation, marriage, etc. These all are being influenced by the cultural factors that affects primarily the health. Then prevention of the occupational diseases. You can do medical measures, you can take. Then prevention of occupational disease, medical measures, engineering measures, legislation, the Factories Act of 1948, the Employees State Insurance Act 1948, then didactic method and Socratic method. Didactic method means it is a one-way communication. Socratic means it is a two-way communication. Example, lecture method in classroom is an example of didactic method. Knowledge is imposed, learning is authoritative, little audience participation, no feedback is taken, does not influence the human behavior. But Socratic method, there is a two-way communication. Both communicator and the audience take part. Audience can ask questions, they can add their own information, ideas and opinions, influence the human behavior. Then what is incineration and inertization? Incineration is a high temperature dry oxidation process. Method of choice when suitable land is not available. Organic and combustible waste to inorganic incombustible matter included. Significant reduction in waste volume and weight. Best to hospital waste disposal method. Involves heavy outlay and expenditure, manipulative difficulties. Manure is lost. But in the case of inertization, mixing the waste with cement and other substances before disposal minimize the risk of toxic substances contained in the waste migrating into surface of water or groundwater. A homogeneous mass is formed and transported to suitable storage site. Typical proportion of the mixture is 65% of the pharmaceutical waste, 15% lime and 15% cement and 5% water. Next comes a question called what is quarantine? What is quarantine and isolation? What is quarantine and isolation? So quarantine and isolation, the limiting of the freedom of movement of such wild persons or domestic animals exposed to communicable disease for a period of time not longer than the longest usual incubation period of the disease in such a manner as to prevent the effective contact with those not so exposed. Applies to healthy contacts of an infectious disease. Applied by health authority to a ship, an aircraft, a train, a road vehicle, prevent the spread of disease, reservoirs of disease and vectors of the disease. Isolation, this is the operation for the period of communicability of the infected person. or animals from others in such places and under such conditions as to prevent or limit the direct or indirect transmission of the infectious agent from those infected to those who are susceptible and who are spread the agent to others. Applies to infected patients to protect the community by preventing the transfer of the infection. Type of isolation varies with the mode of spread and the severity of the disease. What are growth chart as an educational tool to the mother? Explain with the reasons what is growth chart, and then manure pits solve the problem of disposal of refuse in rural areas. Substantiate with your answers. Loose-borne diseases. Example is epidemic typhus, relapsing fever, trench fever, dermatitis. Then indirect transmission of infectious diseases. Indirect transmission of infectious diseases, it is vehicle-borne, vector-borne, mechanical or biological vectors can be there, airborne, droplet, nuclei and dust, fomite-borne, unclean hands and fingers. What are the sampling methods? Simple random sampling, systemic random sampling, stratified random sampling, multiphasic sampling, cluster sampling. Simple random sampling, systemic random sampling, stratified random sampling, then multiphasic sampling, cluster sampling. Then indices of the thermal comfort. You can do air temperature. Air temperature you can look for thermal comfort. What is the air temperature in that room? Air temperature and the humidity you can do for cooling power, the effective temperature, corrected effective temperature, predicted 4-hour sweat rate. Then group approach in health communication, lectures, demonstrations, discussion methods like group discussion, panel discussion, symposium, workshop, conference, seminars, role play are all the effective ways. So there are many questions that have been answered, but they are well discussed in your portions and in PARK textbooks, so you can go through that also.